Little time, and so as people are joining in, so that everybody is there, or most of the people are there, so we can start. Okay, I think we should. Good morning, good afternoon, and good evening to all of you joining from different parts of the world. I'm Satish. I'm the head of program for ATscale. A very warm welcome to all of you for this fourth webinar, which is focused on market shaping in the assistive technology sector. We began this discussion series on market shaping in the space of assistive technology and explored different aspects which influence the market shaping in the space of assistive technology. In today's webinar, the topic which we'll cover today is one of the aspects of market which is generally neglected, and it's around international trade. The questions which we'll try to answer today is how does trade matter in accessing assistive technology, and how can trade policies be shaped to ease access to assistive technology. In today's webinar, we'll also launch the research findings on assistive technology and international trade, as well as launch the policy brief, which has practical recommendations and actions which can be done at the country level to strengthen trade policies for assistive technology. For today's webinar, we'll also like to particularly thank our partners, European Union, for their commitment on advancing healthier assistive technology markets, as well as our partners who have been on the forefront of the research, the Rehabilitation Medicine Institute of the University of Sao Paulo Medical School in this work. Before we begin, some housekeeping notes. The webinar is for 60 minutes, and we hope to finish by 5 p.m. Central European Summer Time. Please keep your microphone muted. The webinar is in English and will be is also translated live in French, Spanish, as well as in Portuguese. Please click on the interpretation button, which is at the bottom of your screen, of your Zoom screen, to access those live translations. Closed captioning is also available in all UN languages: English, Russian, French, Spanish, Arabic, and Chinese. Please click on the link which will be posted right now in the chat box to access those closed captioning. The webinar is being recorded and will be shared publicly after the event. For any questions you may have during the webinar, please use the chat function. We have team members who are monitoring the chat, and they will respond in real time, or during the question answer session, which we have planned also towards the end in the webinar. If we are unable to answer any question during today's session, we will follow up individually after the webinar. Please also use the chat function to provide any general comments or feedbacks you may have as we progress. We'd like to hear any inputs and feedbacks you may have. Lastly, it will be great to have a virtual photo, if possible. If people can switch on their camera for a moment so that we can take a screenshot of all the people and the beautiful faces we have on the screen. I'll have like 30 seconds to do so, and I'll give maybe 10 seconds for people to switch on the camera if they can and if they want. And we should be ready by now. So, okay, here we go. 3, 2, 1. I think we should be able to capture most of the faces who are here. So thank you very much for doing that. In today's webinar, we'll hear opening remarks from ATscale and European Commission. This will be followed by presentations of the findings from the comprehensive assessment which was done on the trade environment affecting their access to assistive technology. This will be followed by inputs from colleagues from partners who are engaged on the aspect of international trade, tariff structures, national taxes and policy environment affecting access to quality and affordable assistive products to population, especially in low middle income countries and settings. We also had a representative from the Kenyan government who was supposed to join, but we just heard just before the webinar that there has been a family emergency. So we'll see if she can join or not. At the end of the webinar, we'll also have some dedicated time for question and answers. So without taking further time, let me invite our Chief Executive Officer at ATscale, Pascal, for his opening remarks and setting up the stage on why we are here today and how does this work contributes in scaling up access to assistive technology to those who need the most. Over to you, Pascal, please.
Thank you, Satish. Dear colleagues, partners, friends, it's a real pleasure to welcome everyone to this fourth webinar of the ATscale discussion series on market shaping in the assistive technology sector. And I think this topic is particularly relevant in today's day and age as the world goes through multiple geopolitical and economic upheavals, in part related to trade. So I think this is really very, very topical and timely. In parallel to these massive changes that we've seen over the last year or two on the trade scene, there's been a growing global demand for assistive technology, particularly in low and middle income countries. Despite this growth, today still, as probably many of you know, on average, only 1 in 10 persons who need assistive technology in low-income countries have access to the devices that they need or the services that they need. And in several surveys that have been carried out, when they are asked what the primary challenge to access is, the answer is nearly always unanimously affordability. And of course, one of the key drivers of affordability are trade-related barriers. So what we want to talk about today and what we want to focus answering today are why does trade matter so much for access to AT? What are the current trade volumes, the tariffs and tax structures that we're seeing out there? And what can we do to affect positive change to ultimately make AT more affordable? We've been working together with partners on this research for over a year now, and we're really excited to be able to share the findings with all of you today. This technical report on assistive technology and international trade takes a critical, evidence-driven step towards demystifying the world of trade, tariffs, and taxes. It delves into the complex and often overlooked obstacles that impede the flow of affordable and appropriate assistive products to those who need it most. And it tries to present the findings in a way that is easy to understand and hopefully apply. As Satish mentioned, let me just reiterate our thanks to the European Union for having supported this work and for their continued commitment to this sector. We also want to thank the Rehabilitation Medicine Institute of the University of Sao Paulo Medical School General Hospital for this in-depth research on this topic. Also, important to thank members of the Technical Advisory Group and the Interagency Working Group on Disability and Trade for their invaluable feedback and guidance throughout the development of this study. And last but not least, I also want to thank the speakers, the contributors, and the peer reviewers of this study. It is really all of your efforts that have made this work possible. So in conclusion, I think if there's one message that really we'd want everyone to take home from today's discussion is that assistive technology is not just a health matter or social issue. It's not just a human right. It is also a fundamental trade issue. And we need to look at it from that perspective as well. And so we're eager to hear from all of you today about practical ideas and commitments to further collaborate on this important agenda. Let's make this the start of an ongoing dialogue on international trade and assistive technology. Thanks again, and back to you, Satish.
Thank you, Pascal. And thank you for the emphasis on the critical importance of demystifying the complexities of trade, tariffs, and taxes, as this understanding does significantly influence access to assistive technology. With this, I'd like to also invite Laure Roges for her opening remark. Laure is the team lead for inequalities, social protection, and rights of persons with disabilities at the Directorate General for International Partnership in the European Commission. Over to you, Laure.
Thanks a lot. You hear me well? Yes?
Very well, Laure.
Okay,
Very well.
perfect. So, dear colleagues, partners, ladies and gentlemen, welcome and thank you for joining this webinar. It really is a pleasure to see so many of you with us today. Disability inclusion is a core part of the European Commission's internal and also external action. Actually, earlier this month, the European Commission adopted the communication enhancing the strategy for the rights of persons with disabilities up to 2030 with an external chapter. I will put the link in the chat in case some of you want to have a look. This communication has the objective to step up the ambition of the strategy with a strong and stronger even focus on implementation, delivery on the ground, and real impact for people's lives. Reading the report launched today, I am convinced that all of us here share this intention to deliver and have impact. So that's why I wanted to mention this new piece, this new communication. Disability inclusion is anchored in the EU's obligation under the United Nations Convention on the Rights of Persons with Disabilities and in the principles of the 2030 Agenda, particularly the central one of leaving no one behind. In our international partnerships, disability inclusion is not treated as a separate or as a marginal topic. It is integral to how we work on human development, governance, sustainable growth, and the green and digital transitions. And assistive technologies are central to making this a reality. For many persons with disabilities, access to assistive technologies, wheelchairs, prosthetics, hearing aids, glasses, communication devices, digital solutions, etc., is what enables participation in school, in work, in community life, and in democratic processes. Assistive technologies are enablers of autonomy, dignity, and equal opportunities. Yet, access remains deeply unequal, as we just heard from Pascal. The result is that millions of persons with disabilities, particularly women and girls, people in rural areas, and those living in poverty, are left without the tools they need to realize their rights in practice. From the perspective of the European Commission, assistive technologies are not only a social or a health issue, but also a development, economic, and trade issue. And here I echo what Pascal said again. This sits at the intersection of human rights, inclusive growth, and innovation. Their social impact is undeniable, but allowing their users to contribute to economic growth, they also play a key role in proving that investing in the rights of persons with disability is not only a cost, but a real investment, with not only a societal, but also an economic return. You may have heard about the Global Gateway. It's the European Union strategy to support sustainable and trusted connections with our partner countries. Within this strategy, we are working to mobilize quality investment to promote fair transitions, fair economic transformations, let's say. We seek to integrate the social and economic agendas by combining hard investments in infrastructures with soft ones in regulatory frameworks, environmental, social, and governance standards, training. And within this framework, we really see a strong opportunity to support ecosystems that can expand the availability and affordability of assistive technologies in partner countries. The report being launched today speaks directly to this opportunity. It looks at how trade-related policies, taxation, and related procedures and practices influence access to quality assistive products. It helps us better understand where the bottlenecks are in tariffs and non-tariff barriers, in regulatory environments, in information and practices. For the European Commission, this analysis is valuable as it helps identify where targeted action can make a real difference. It will inform our policy dialogue with our partner governments and our partner organizations, and we retained particularly the following elements: to reduce unnecessary barriers in essential assistive products, to integrate assistive technologies into broader health, education, social protection, and digital strategies, to support the access to markets of assistive technology producers and providers, including European ones, but also strengthening local and regional manufacturing and service capacities, and ensure that representative organizations of persons with disabilities are meaningfully involved in all stages of this work. Now, allow me to emphasize this last point. Nothing about persons with disabilities should be decided without their full and effective participation. This principle must also guide our efforts to expand access to assistive technologies from policy design to implementation, monitoring, and evaluation through the whole project cycle. I would like to warmly thank ATscale and also colleagues based in Brazil, muito obrigada, and the whole team behind this report, and all the stakeholders who contributed with their expertise and experience. Your work helps us move from political commitments to concrete and evidence-based action. I encourage all of you today to use today's webinar to engage critically with the findings, to share country experiences, and to highlight opportunities for collaboration. In the European Commission, we are interested in identifying, together with you, how we can accelerate progress and ensure that persons with disabilities in low and middle income countries have access to the assistive technologies they need to fully participate in society and in the economy. Thank you very much.
Thank you very much, Laure. Thank you. And thank you for emphasizing the policy priority for the Commission on disability inclusion, as well as on the importance of assistive technology and trade, and how trade can make a difference between access and limited access or no access. Also, thanks for identifying and elaborating on the EU financial mechanisms, opportunities which can strengthen assistive technology markets. Thank you very much, Laure. Now, let me invite Vinicius Ramos and Natália Jardim. Vinicius is the Executive Director and Natália is the Research Associate at the Rehabilitation Medicine Institute of the University of Sao Paulo School General Hospital. That's a long one. Vinicius and Natália, who led the research team on development of the report, will present the key findings as well as the practical recommendations stemming out from that work and share those findings and recommendations with all of us. Vinicius and Natália, the floor is yours, please.
Thank you, Satish. It is indeed a long name, and it's also nice to highlight that we are a WHO collaborating center on rehabilitation and assistive technology, and this is why we have been inside the hospital, have a research group that is going outside the health per se spectrum and also looking at other aspects of access to assistive technology. Muito obrigado muito especial também aos colegas de Moçambique. A gente apresenta em inglês, mas é sempre bom saber que tem países de língua portuguesa e foi bom conduzir esse estudo junto com Moçambique. I will just present a very introductory sections on the scope of the study, the methodology we use. Then Natália will be presenting on the study results, and I will be back again to highlight some of our key recommendations. So for Laure and Pascal have already made a great point on what this is an issue, and Natália, if you can change, thanks. So the need for assistive technology is huge, that we have low levels of access, and affordability is a big part of it. And when we lack local manufacturing, and this is actually the rule, not the exception, it implies that imports are key to having products available and that people can then access them. And for that, we have multiple layers of barriers that go from the trade potential and the agreements that might be established to try to make this potential greater and countries to benefit more from that, but also the tariffs that are applied at national level, the taxes that are also regulated nationally, and the logistics aspects of having this product coming from ports to the retailers. And what we have concentrated in this work was actually how to tackle all of those barriers, considering that manufacturers are often concentrated in only a few countries, and many other countries in the world will rely on importations to have access to them. So the scope of our study was focused on a few products, assistive products, and these are hearing aids, orthotics and prosthetics, spectacles and wheelchairs. These are the assistive technology, the assistive products that ATscale it's often looking at. And it was also relevant that we were focusing on those because of the way that we can track information internationally. And we did that using the harmonized system codes that it's what we use internationally to track any product that's traded internationally. And we are looking at this later to say that how these are coded, how these products are coded it's really relevant from the level and quality of information that we can get. It was a Pan-African study in some aspects of this. We had looked at trade flows and some of the tariff levels across the region, but we had a particular focus on Chad, Egypt, Kenya, Mozambique, and the Republic of the Congo. And when we go into detail for all of those different countries, and of course you have more information in the technical report that was published, and here we are only having a general overview of our findings. And it's also important to highlight that we haven't looked at the entire supply chain. This would be a huge study. So we are focusing on the import to distributor aspects of this. So it's port clearance, nationalization, and distribution. We are not looking at one end, the manufacturer costs and all of those other implications, and also at the retailer's end. So we are looking at the middle of this process and how the international trade aspects of this are highlighted. To conduct such a study, we used a mixed methods approach. So we had both a quantitative trade analysis, data analysis on the trade, the hard data on trade flows, but also qualitative analysis for the national legislations, the international agreements that exist, and a literature review on access to health products in general and assisted products in particular where these were available. We had an analytical framework that allowed us to make comparisons across countries and consolidate these findings, and this is what you find in our technical report. And we tried to make this, as Pascal mentioned before, more of a participatory approach as well, having more than 40 experts consulted either through interviews or through our technical working group and the peer reviews that went after that. So we, as I mentioned before, much of this work was based on the harmonized system codes to know how we can track and identify these products. And Natália will be showing you next how it looks like at the end right now.
Thank you, Vinicius, and hello, everyone. My name is Natália Jardim, and I'm one of the researchers on the study, and I'm going to be presenting some of the key findings and key data that we have collected through our project, starting with an overview of the AT trade flow in Africa. So the first aspect that we would like to highlight is that the African continent accounts for the smallest share of global AT imports. So we have the imports of hearing aids, prostheses, and orthoses, spectacles, and wheelchairs by African countries have totaled 6.5 billion USD between 2016 and 2023, and that represents just over 1% of total global imports. So on the figure on the left, we have the share of global imports along with the share of global population. And we have that Africa sits right at the bottom of the list with just 1% of the share of global AT imports. And at the same time, we have that the African continent relies on external markets for most of its assistive products imports. So between 2016 and 2023, interregional trade accounted for only 3.6% of total imports of AT products in the African continent. So on the figure on the right, we have that Denmark leads as the main exporting market for hearing aids for African countries, while the United States leads as the main exporter of prostheses and orthoses, and China leads by far as the main exporter for spectacles and wheelchairs to the African continent. And the second aspect that I would like to highlight is in terms of the tariff regime for assistive technology in Africa. So we have that tariffs on spectacles specifically can reach up to 30%. So while most countries grant tariff exemptions for hearing aids, prostheses and orthoses and wheelchairs, many still impose duties on spectacles, lenses, and frames, and that can sometimes reach up to 30%. So on the figure on the left, we have the average import tariffs for our four target assistive products, that being 1.4% for hearing aids, 1.6% for prostheses and orthoses, 1.8% for wheelchairs, and 8.4% for spectacles, so a much higher value for import tariffs. And the main reason for that is that spectacles are still classified as consumer or even luxury goods in many countries. So among our 5 select countries, tariffs on hearing aids, prostheses and orthoses and wheelchairs range from 0 to 5%, while the average tariffs on spectacles can go up to 26%. So on the figure on the right of the presentation, we have the average tariffs for hearing aids, prostheses and orthoses, spectacles and wheelchairs for the top 15 African countries with the highest tariffs. And we can see the figure illustrates how the average tariff for spectacles is much higher than the average tariff for the remaining assistive products. And now we move on from a broader view of the African continent as a whole to a more specific and focused view of our 5 select countries. So in terms of AT tax structure, we have the treatment of assistive technology under the VAT, which is the value added tax regime, remains very inconsistent. So VAT systems follow a broadly similar architecture with standard VAT rates complemented by exemptions or zero rated for priority goods. However, the VAT treatment for AT is much more inconsistent. So the figure on the right of the presentation illustrates the standard rate and the main VAT mechanism for our 5 select countries. And it shows that while hearing aids, prostheses and orthoses and wheelchairs are often exempted, spectacles, lenses and frames still remain subject to full VAT. And now, when we unpack the cost of all these import-related tariffs, taxes, and fees, we see that they together can drive the product price to 1.6 times the ex-factory price. So, for example, if the same tariff and tax exemptions that are currently applied to hearing aids, prostheses and orthoses and wheelchairs in Kenya, one of our select countries, were extended to spectacles, the tax burden for import tariffs and VAT will be 0. So on our figure on the left of the presentation, we have, for example, the cost for spectacles imports to Kenya and the price after customs clearance and nationalization. So we have the ex-factory price, and on top of that, we have 25% average logistics fee, a 10% import tariffs, and a 16% VAT fee. So we have that in this scenario, the price after customs clearance and nationalization is 1.6 times the ex-factory price. On the other hand, on our figure on the right of the presentation, we have the cost for hearing aids imports to Kenya. So in this scenario, we have on top of the ex-factory price, only the 25% logistics share of the import cost. So in this scenario, the price after custom clearance and nationalization is 1.25% times the ex-factory price. In our study, we also took a look at the role of preferential trade agreements, or PTAs, in improving access to assistive products in the African continent. So PTAs are trade agreements among partner countries that can lead to reduced tariffs and taxes on selected negotiated items. So we found in our study 12 applicable PTAs that address tariffs on key assistive products in the African continent. And the main example we have of PTAs working towards improving access to assisted products come from the Republic of the Congo. So Congo has shown a significant increase in imports from the African Continental Free Trade Area, or AFCFTA member countries since 2019. So on the figure on the right, we have two scenarios. The first scenario is between 2014 and 2018, so before the AFCFTA trade agreement began its effect. So we have the imports of assistive products coming from partner countries to Congo represented only 2.4% of imports in Congo. However, in the following 5 years, so after the agreement took place and it began its effects between 2019 and 2023, the same share of imports coming from partner countries to Congo of assisted products jumped to 26.1%. And finally, on our study, we also have brought a few case examples of African countries that are able to advance access to assisted products by reducing import tariffs and taxes applied to the imports of AT. And our main example comes from Zimbabwe, advancing national prioritization of AT. So for this specific case study for Zimbabwe, it all started when the Ministry of Health created a AT multi-sector working group with partners within the country. And the first task of this working group was to develop a national strategy and a priority list with products, assistive products that were relevant to the national context. So they developed a 55 product national APL list with 50 products coming from the WHO, the World Health Organization list, plus 5 context-specific items selected by the working group. And at the same time, we had organizations of persons with disabilities, or OPDs, highlighting the tariff and tax impacts on access to assistive products in the country and advocating during the national budget consultations. So as a result of this advocacy and the work of this AT working group, the Zimbabwe Revenue Authority conducted a revenue impact assessment and concluded that revenue coming from tariffs and taxes applied to assistive products could be foregone, and that this would be manageable within the fiscal and tax context of the country, and that these exemptions would align with broader social welfare objectives. So as a result, VAT regulations were amended and the government eliminated import taxes on priority assistive products for registered OPTs. So these are the main findings and results that we have on our study, along with some key case study examples that help illustrate the data that we have shown. And of course, once we look at the report, we have the broader analysis behind our data and our findings, but these are some of the key numbers that we wanted to bring to you today. So thank you very much.
Thanks, Natália, for sharing the highlights of our results. And as Satish mentioned in the beginning, we tried to do this as action-oriented as possible. And this is why we had constructed these key recommendations with the support of our experts that were collaborating with our work. And the first recommendation, like Zimbabwe did, was having a cost-benefit analysis of the revenue foregone and how actually it's worth it, that you have a larger benefit for the population than you have giving up on that revenue for the country. And the second recommendation is about making the existing exemptions actually effectively applied. They are often existent on paper, but not in reality. And there are strategies to try to come up with solutions for that. It's also relevant, as I mentioned in the beginning, that we have better harmonized system codes that are more accurate and that actually reflect the assistive products that are on the market, and that we can track this information. Just as a quick example, there is only one harmonized system code for hearing aids. There are 3 for wheelchairs. There are a few more for orthotics and prosthetics, and even more for spectacles, lenses, and frames. So then on one side, when they are many, they are also more discriminatory, but when sometimes they are not even existing, or they make comparisons really hard to make across countries. And it is important that we take the work of the World Customs Union, for example, to make these codes more relevant across countries and used across countries. It's also essential that it's important that we have assistive products as essential goods, that we create priority lists to benefit from cross-sector and whole of government efforts to increase access to assistive products. We should, as our 5th recommendation, train officers and officials to identify assistive products and ensure, as we have mentioned before, that the exemptions are effectively applied. And this depends on the capacity of officers and officials working in the field with customs clearance. We should, and this is a very large, probably one of the largest scope in terms of our key recommendations, align our trade policies with the national or regional production of AT. This is how we combine access and access through assistive products, through importations, to the local industry, and how oftentimes we want the local industry to deliver on these products as well. So the way that we work with preferential trade agreements, common tariffs across countries, and create a national or regional approach to push for local manufacture, but also gain scale from having countries working together at a regional level. It's important that we have awareness raising for private sectors, because private sector actors, because this implies in distributors and retailers that need to be aware of these mechanisms, but also society at large, so that final users know how this works and can also benefit, because oftentimes the exemptions and benefits rely on end users and not only from retailers, depending on how each country organize it. And to complete, it's also relevant, because we are mentioning all of the different stakeholders in this field, that we are able to coordinate among these actors and actually have users participating in this. This is relevant for prioritization, this is relevant for clarity in this process, and it will only benefit the entire ecosystem that we have the different stakeholders actually participating in all of those efforts that are needed to have these recommendations in place. So this, I hope we were able to share everything that we have done throughout the work. And of course, we will be available through the questions and answers section as well. Thank you.
Thank you. Thank you, Vinicius, and thank you very much, Natália. And thanks for presenting the assessment findings, as well as the clear recommendations to make assistive technology more affordable. Also, on your point on the importance of ensuring that existing exemptions are applied at the country level, and the importance on awareness raising in this space. The study was, of course, based in selected countries in Africa, but the learnings and the guidance and the recommendations which stand out from it can be applied to any country who is interested to scale up access to assistive technology. It's now good time to invite different stakeholders who are related with the assistive technology ecosystem and different partners who are engaged on trade and tariffs. And with that, I would like to invite UN Trade and Development, an intergovernmental agency, is at the center of developing policies on trade as well as related governance. It's a pleasure to invite Ralf Peters, who from UN Trade and Development. Ralf is the chief of the Trade Analysis Branch within the Division of International Trade and Commodities. Ralf, it will be wonderful if you can help us to and brief us on your efforts being done with regards to disability inclusive trade, as well as if there are any other lessons which you see in other sectors, be it gender, public health, or other related sectors, which can help us to reduce taxes and tariffs in the space of assistive technology, and we can learn from them. That will be also beneficial. Over to you, Ralf.
Thank you very much. And let me begin by congratulating the team behind the technical report and the policy note. These are highly valuable contributions that help more disability inclusive trade from concept to actionable policy. I would like to make 3 points. My first point is efforts of international organizations. We are seeing a clear shift across the international system from treating disability inclusion as a social issue to recognizing it as a core trade and development priority. At the outset, it is important to underline that disability inclusion in trade remains a relatively new area of work for many international organizations. While progress has been made, much of the conceptual and policy groundwork is still to be established. In this context, it is particularly encouraging that the latest UNCTAD mandate, agreed in October 2025 in the Geneva Consensus, marks a major milestone. For the first time in UNCTAD's history, it includes specific operational paragraphs on disability inclusion in trade, reflecting clear recognition of UN member states. It is a decision by our member states, of course, but I would like to recognize here the amazing work that has been done by my colleague Graham Mott, who is also here in the meeting, in the UNCTAD Secretariat to support the member states. International organizations bring distinct comparative advantages to this agenda. First, through evidence and analytical work. A key example is UNCTAD's ongoing work to improve product classification and data availability, including a comprehensive mapping of assistive products against HS codes using the WHO Priority Assistive Product List. This work will improve the quality and completeness of trade analysis, helping to better quantify barriers and inform policymakers. Second, through specialized expertise, UNCTAD has a long-standing role in analyzing non-tariff measures, we call them NTMs. While tariffs have declined over recent decades, despite some recent high-profile reversals, it is non-tariff measures, including standards, procedures, and administrative requirements, that increasingly shape trade outcomes. Looking ahead, UNCTAD will begin to work to assess how these barriers affect trade and assistive technology, where their impact may be even more significant than tariffs. Third, through technical cooperation, supporting countries to improve data gathering, customs procedures, regulatory frameworks, and policy alignment. Overall, the direction is clear. Trade is increasingly understood as a tool for inclusion, but one that requires more comprehensive analysis and coordinated action. My second point is on the interagency working group, which has been established in 2023. By UNCTAD, WTO, ITC, and ILO. This interagency working group on trade and disability inclusion brings together a growing number of organizations to move from fragmented efforts to coordinated and strategic action. Its importance goes well beyond coordination alone. First, it strengthens policy coherence across institutions, helping to address fragmented governance structures in this area. By aligning approaches and priorities, it ensures that disability inclusion is integrated more consistently across trade-related work. Second, it enables practical collaboration and joint delivery. A number of joint panel sessions and events have already been organized under the working group, bringing together expertise from across organizations and raising the visibility of the issue. Third, it enhances communication and knowledge exchange. This is particularly important in a field where data gaps and conceptual challenges remain. The working group provides a platform to share methodologies, experiences, and emerging evidence, helping to build a common understanding. Fourth, it supports the development of forward-looking work programs. We are now moving beyond dialogue towards the preparation of joint project proposals with a view to scaling up technical cooperation and impact. Fifth, it strengthens engagement with member states, which is essential to ensure that this work translates into policy change at national and regional levels. Importantly, cooperation is essential, particularly in the current context of constrained financial and human resources across organizations. By working together, we can maximize impact, avoid duplication, and advance a coherent and effective work program. While still in its early stages, the working group has strong potential to become a central platform for advancing disability-inclusive trade globally. Let me come to my third and last point, Satish, you mentioned this, the lessons from gender, public health, and emerging evidence. There are strong lessons from gender equality and public health that can inform this agenda. As a relatively new field, disability-inclusive trade has benefited significantly from expertise at the intersection of gender and trade, including work by Sophie Mishra and Marzia Fontana. Their contributions have helped establish the analytical foundations of this emerging policy area. Several key lessons stand out. First, distributional impacts matter. Trade policy affects persons with disability both as consumers, through the price and availability of goods, and as workers, through access to employment and participation in value chains. Second, accessibility itself can act as a trade barrier. Inaccessible standards, certification systems, or digital platforms can exclude participation, while inclusive design can expand markets and opportunities. Third, from public health, we know that essential goods, such as medicines, are often tariff exempt or zero rated. Yet assistive products, and we have just heard this from the presentation of the report, particularly spectacles, are still frequently treated as consumer goods, facing tariffs up to 30%. Designation matters. Fourth, data drives policy. Significant gaps remain in how assistive products are classified and measured in trade statistics, limiting effective policymaking. Finally, progress depends on whole-of-government coordination, bringing together trade, finance, health, and social sectors, alongside engagement with organizations of persons with disabilities. So let me conclude with a simple point. If we are serious about inclusive trade, then we must be equally serious about removing trade barriers, both tariff and non-tariff, that prevent people from accessing the tools they need to participate in the economy. We increasingly have the evidence and the tools. The question is whether we will act on them with the coordination, ambition, and urgency required. Because ultimately, a trading system that excludes persons with disability is not only unjust, it is economically incomplete. Thank you very much.
Thanks a lot, Ralf. And thanks for also explaining on the work being done by the Interagency Working Group on Disability and Trade, as well as the efforts which have been done from the trade and development to support countries in reducing tariff and taxes on assistive products. Also, very important point which you mentioned around trade as a tool for inclusion, to ensure that everyone who needs assistive products can access them, as well as the also re-emphasizing, as Vinicius had done earlier on, the importance of assistive products classification in the trade system, which needs to be strengthened. So thank you very much for those insights, Ralf. Now, let me invite our good friend and colleague, Fernando Botelho from UNICEF. Fernando is responsible for assistive technology and plays a key role in scaling up assistive technology in the countries. He's joining us from Nairobi in Kenya. Fernando, UNICEF, along with its partners, which include civil society, international and national non-governmental organizations, are at the front line with the government to improve access to assistive technology. In all those situations, UNICEF and its partner needs to get assistive products across the border, which is where the national taxes and tariffs gets applied. If you can brief the participants of this webinar on what role UNICEF, along with its partners, are playing and doing to address tariff and non-tariff barriers at the country level in the space of assistive technology. Over to you, Fernando, please.
Thank you so much, Satish, and thank you as well to Pascal and the entire team at ATscale, as well as to Vinicius, Natália, and the entire team at University of São Paulo. The contribution we've made with this work is extremely valuable, and a lot of it confirms our experience. A lot of it reminds us of things we already knew, but now it gives it a solid basis that is derived from research. So thank you so much. I was particularly, what came to mind as especially valuable, and this confirms our experience at UNICEF, is the importance of organizations of persons with disabilities and the existence of a coordinating body that brings together different ministries. So you make it cross-sectoral, not just within government, but you make it cross-sectoral across society. So you bring the private sector as well, you bring organizations of persons with disabilities and other users of AT. It's not just that. It was also really wonderful to see the emphasis you've given to costs that are related to logistics, that are related to transportation, and just complexity. We tend to, whenever we are coming from the perspective of wealthy countries, we tend to underestimate how big a barrier that simple complexity, that's perhaps not the best construction, but just complexity can have on the provision of assistive technology. And this is where some of the experience I've had I can share, because I think it complements and reinforces what you have highlighted in this study, in this work. Looking at this, immediately we have questions about so much more that we would like to know about other areas of assistive technology, other industries, and this is a natural reaction. But I think we need to emphasize here that there's a lot of value that we already have, a lot of understanding that we can already derive from this work, that we can call low-hanging fruit, that we can act on immediately. We do not need to know everything about every sector of AT to start making a difference. So, for example, the need for simplification of importation procedures, the need for better training, the need for involvement of users of assistive technology, because a lot of knowledge is contextual, a lot of knowledge is based on the needs, on the specific circumstances of each country, and the best persons to help a government prioritize what needs to be done first, how things could be simplified. A lot of local knowledge will inevitably be best sourced from those that use assistive technology. Now, I want to warn, and I think this is already something that comes through in your work, that simplistic approaches are never effective. And what I mean by that, any generic rule like let's bring all tariffs to zero in assistive technology, that when it has been done, hasn't been sufficient. So we need to have a sophisticated view, because it's not only about trade, it's also about the balance between what has to be done locally, what has to be imported, and what has to be a mix. So, for example, we need to carefully consider in the different types of assistive technology, what's the market size? Is there a trade area agreement with other countries that could make it viable to produce locally? Also, never underestimate the complexity of producing locally. Make sure You, the government, you, the user, you, the coordinating body of assistive technology in the country, consult other countries that have successfully brought production in. Sometimes it's just assembly of products, other times it's more complete than that. But you have to make sure you look at it in a systemic way and you consider the market size, the cost of the item, and whether it's worth it to bring and what elements of that supply chain should be brought into the country. So that's a big red flag for me, any oversimplification of the process. But I think the ultimate approach has to be you stick very firmly to your principles. Principles such as let's maximize the benefit, the number of people getting access to assistive technology. Let's have a cross-sectoral approach. Let's bring in all the knowledge we can from the health sector, from the education system, from the social protection system, from the private sector, from organizations of persons with disabilities and other relevant parties. But you have to be flexible in your implementation. Each industry may require a different approach, and you cannot have generic rules that will work perfectly well across multiple segments of the assistive technology sector. So I think this is a wonderful piece of work. I think you are leading by example by bringing all of us, bringing the UN system to this discussion, reaching out to many segments of this sector in your research. And I want us to continue in this style, in this approach. We have to act on what we know and be humble because the challenge is great, but the reward is immense. As a user of assistive technology, I can tell you firsthand that it does change lives. Thank you so much.
Thank you. Thank you very much, Fernando. We are right on the hour, and we will take a couple of questions. So apologies for choosing the time. There's one question or a few questions which are there, and they're quite interesting. I'm not sure we'll be able to answer all of them. We'll definitely respond to the people individually, and we'll reach out to them individually. Few questions which I want to pick up, Vinicius. One is related with local manufacturing, and how does in the research work, was there any findings which also illustrated the importance of local manufacturing in the sense that the products or the parts of the assistive products were imported and then local manufacturing being done, and how did that had an impact related with trades and tariffs and barriers?
Thanks, Satish. I think first, this is one of the examples of how hard it is to track information when we do not have specific codes. So like we cannot count on raw materials that are specific for assistive products because they can be used for other products as well. So we could not be specific to this. But it is important when we look at national legislation systems and how they make spare parts and assistive products components also exempted, not only the products, the entire products, but also the parts and accessories. And as Fernando also mentioned, sometimes assembly is the first step when you're thinking about local manufacturing, and striking this balance on how you relay on international trade and how you rely on your local industry to provide for your users. It might imply that you have, for example, a regional agreement where you have different countries working together to build this, not only the scale for at the demand side, but also the industry at the supply side. And you can organize your system to make the trade among these countries easier and also with no tariffs, so that you can manufacture these products locally and trade them between these countries, so that you have both demand and supply happening at a regional level. And this already happens with many other industries in many regional markets, and we could have this for assistive products as well.
Thank you, Vinicius. I was just told that probably my voice was not clear. Is it still audible, Ranja?
It's better now, yeah.
It's better now. Okay, apologies for that. Fernando, I see your hand, but while I guess you will compliment to Vinicius, I also have one question for you and for Ralf. So one question for you, Fernando, in addition to what you want to compliment to Vinicius' earlier remark, is is focused on how do we engage with the national governments, to reduce or get exemptions and relief from taxations. What should be the right process of engaging with the national governments? Over to you, Fernando.
Well, as in so many other areas, this is going to be very specific to your circumstances. But what I have seen is that something that is universally valuable to countries are changes that cost little but have a great benefit to them. So the type of analysis that you've done with this work is very crucial, because you're showing that with very little revenue impact, you have a tremendous social impact. So this is precisely the kind of argument that is very much welcome by most national governments. What I wanted to also bring up is this balance between local production and international trade or importation. We've seen recently disruptions to trade caused by the pandemic. Now we're going to see another very significant one caused by the energy crisis. And we've seen in the past periodically in many countries disruptions caused by currency exchange fluctuation and related crises. So I think it is important that when we make a decision on the strategy that we want to adopt, that we consider not just the immediate impact, but the long-term stability of supply and the long-term benefits to the economy of the approach that we choose. Thank you.
Right. Thank you, Fernando. Thank you very much. I'll just take one more question, which was there in the chat. And this is, it will be great, Ralf, to have your perspective on that, is how do we engage regional mechanisms like the African Union or the African CDC or other regional intergovernmental mechanism in trying to address the trade and tariff related issues?
Yes, thank you. I think it's important to engage with all groups here. I mean, the tariffs are, of course, a national decision. So it's the nations that decide on the tariffs, except if there is a customs union, then they have they have the same common external tariff. But I think it's good if we use all blocks to support the work. And we are at very early stages here, I think. So I think we are at a stage where we do awareness raising. We show them, what are the consequences of having higher tariffs on these assistive devices. And once we have done some more work in line of this, I think we can work with all regional blocks, the ones that you mentioned in Africa, to inform member states about the situation.
Right. Thank you, Ralf. I see one hand from Dr. Anil Jaggi. Anil, please go ahead, but if it will be great if you can keep it brief.
Yeah. Thank you, Satish. Just for your information, we are working on a research program between India and Japan, and the challenge between India and Japan is that cost and the barriers, right? And that's the reason that government of Japan has given us this study that Indian AT companies, because they are cost effective, innovative, and how we can have some kind of synergy. You mentioned about regional mechanism, so I think that is one. And second, on the ESG side, we have and CSR also, where a lot of companies are spending money on the CSR, but not much on the disability. That this is a study which is saying. So any kind of that pressure or any kind of policy on the ESG kind of thing, that AT pools or AT funds can also be that the contribution of that their investment should go for that, because I met 30-40 AT startups in the last 20 days, and I'm finding that all of them are facing the challenge of scale up and the right kind of product. So thank you.
Thank you, Anil. So how CSR can support in this process. I think that's the point which you're making. And thank you for also highlighting the study which has been done on the Japan and India AT market. We will certainly connect with you to learn more on that. We have gone over the time, and my apologies for that. The technical report and the policy brief for assistive technology and international trade is available online, and we'll have the links in the chat. The webinar recording will be also shared publicly and will be available at the ATscale website as well as on social media. The next webinar in this market shaping series on assistive technology is expected to focus on assistive product market platform, and everyone will be invited for that also. Invitations should come by the next month. We hope to continue working on these with those present here and to continue this conversation on how to build healthier assistive technology markets and break down trade barriers globally. So have a great day and night ahead, depending where you are. Thank you very much for joining, and thank you very much for your time.
Thanks, everyone. Thank you very much. Thanks, Satish.
Thank you.
Thank you, everyone.
Thank you.
Thank you, everyone.
Thank you, everyone.
Thank you.
Thanks, everybody.
Thank you from me too.